We have less hospitalizations for chickenpox in the United States than we did for COVID-19 in that age group. And again, I think when you look at that number, yes, it's true. It takes a lot of vaccines to prevent one hospitalization in a young age group. But remember, within that, you're looking at it as a whole. Remember, there are children that are under the age of 5 that have asthma, that have had a bone marrow transplant, that have had a heart transplant, that will clearly benefit. This is not a mandate in the United States or Canada for this vaccine, and it shouldn't be a mandate. But there are clearly children that will benefit, and I think you have to recognize that. Not every child will benefit the same from this vaccine, and there is a different risk-benefit calculation that you have to put into place. But on balance, I think that this is a comparable vaccine to other childhood immunizations that we give in the United States.
Dr. Tess, Lawrie, if I can come to you, could you evaluate for us what you regard as the risk versus the benefit of giving children and babies this procedure?
Yes, I can assure Dr. Adalja that this vaccine is not like other childhood vaccinations and cannot be considered in the same light. This vaccine is extremely dangerous. It is not safe and effective, and it's potentially fatal. So the evidence does not support its use in children, in babies, in pregnant women, and actually in anybody at this stage, because we have seen the data emerging on the pharmacovigilance databases, and the official data do not support the use of these genetic vaccines. And if I can just remind you how they do not work the same way as other vaccines. It is a new technology that has not even sufficiently passed animal studies on safety, and yet we have rolled them out to billions of people around the world. These new vaccines give our bodies a recipe to make spike protein, a foreign protein, a viral protein with no off switch for an indefinite period of time. This vaccine does not stay in the shoulder muscle. It circulates around the body and gives our cells a recipe to make spike protein that then causes an inflammatory reaction throughout the body for an indefinite period. The pharmaceutical companies have not disclosed all the ingredients in these vaccines, and we know from independent scientists with no conflicts of interest that there are many undeclared contents, including graphene compounds and metallic objects. And these need to be revealed and disclosed by the pharmaceutical company before we give these injections to anybody else, especially our children.
Dr. Amesh Adalja, how do you respond to that? To my unscientific, non-medically trained ears, that's a fairly damning account of these therapies that are being offered to children.
It's a damning account, but it's completely detached from reality, detached from evidence. So basically what you've heard are a bunch of arbitrary assertions that are cognitively meaningless. Because when you look at the data from actual sources that are vetted, you don't find any of what the prior speaker said to be actually true. You can look with your own eyes in terms of the power of these vaccines to prevent severe disease, hospitalization, and death. You can see, I just came from the hospital. I was rounding at the hospital today, taking care of COVID patients. I know what the power of this vaccine is. And the fact that it is an mRNA vaccine, the fact that it is using innovative technology, that is a feature, not a bug. We've been advocating mRNA vaccines be used in emerging infectious disease and pandemic preparedness because of their speed, their agility to be able to be made and to be refined. And the fact is, this doesn't cause a persistence of the spike protein. mRNA is degraded very rapidly. Most of what she said has been debunked by multiple studies. But when you're in these types of forums, it's very hard to be able to give a complete case for all of it. And it sounds reasonable when she says it, but it's completely detached from the evidence that we have in front of our eyes, the evidence that's been published in multiple medical journals, and the evidence in our hospitals. And I think that this is just a dangerous methodology of thinking that you're seeing exhibited.
Dr. Lawrie, Bev Turner, I will come to you, but Dr. Tess, Lawrie, I have to let you respond to those statements.
Thanks very much. It really seems like Dr. Adalja is not looking at the evidence on the databases because the clinical trials were interrupted. They have never been completed. So the only data and certainly Safety data is something that takes many years to accumulate. We do not have safety data on these vaccines. We do not have long-term safety data, and it's a new technology. So Dr. Adalja obviously has not looked at the VAERS database or the World Health Organization's database, on which there are 4 million reports of adverse reactions. And on our UK database, there are 500,000 reports of adverse reactions. So 500,000, 500,000 people in the UK have reported reactions to their vaccine. And if we take 50 million, that's 1 in 100, and we know these data are underreported. So Dr. Adalja is using anecdotal evidence from his hospital experience, and we know that many of those hospital cases are just cases with COVID because they've been tested as PCR. They're not people with COVID as an illness, with COVID disease. And what we are seeing on the Canadian COVID Care Alliance's data, they've analyzed their data, and we are looking at data. Jessica Rose has been, many independent scientists are looking at the data, and it's clear that in actual fact, there are more cases of COVID with COVID vaccination, particularly with a booster, and there are more COVID deaths. So these vaccines must be stopped, and the World Council for Health issued a report last month to say that there is sufficient evidence of a significant safety signal on the databases, and these products should be recalled.
Bev Turner, this is a story that you've been following closely in the UK for months, if not for years now. How do you react to the news from Canada?
Well, for a start, Tess is 100% right, and our friend from America is 100% wrong. I'm involved in this because, along with a group of lawyers in the UK, we filed for a judicial review in September 21, when the government started talking about injecting the under 18s. And it was so obvious that this was a disease which was affecting the very elderly, the very vulnerable, and there was no clinical need for a healthy teenager to be given a trial mRNA drug. And as the doctor just said, we have been trying to get mRNAs used for years. That's true. And there's a reason why they weren't given the green light until COVID happened, because suddenly they've been pushed through under the auspices of this emergency from which children need rescuing, under this emergency use authorization. I would just ask any parents watching this, do you feel that your children are in the middle of a COVID emergency from which they need to take a risk by taking a drug with what we now know are demonstrable harms attached to it for a disease from which they are not at any risk whatsoever? That is the crux of this. And as part of that legal case that I've been involved in, what we've struggled to get, Neil, is transparency. We have struggled to get clarity from the government. We are still at it a year later. We are filing every time another age group gets lower and lower and lower. We have not yet greenlit 6 months to 5 years in this country, but they will do so. They will do so. And, the JCVI here said we can't decide whether we can't greenlight this. And so they kicked it over to the chief medical officers, who said, we're going to give this to children for their mental health, because they said they won't miss school from COVID. What they didn't do in February, which they actually did last September, because we made them in court, they then had to measure that against any days of school that might be missed from an adverse reaction from the drug. And it is clear, and it is patently obvious to see, even in Pfizer's own original underpowered trial of 1,131 children, which is nothing. The number of adverse reactions amongst those children, I'm not talking about the serious cases of myocarditis, we're not talking about severe incidents, even just the cases of vomiting and diarrhea and temperatures. It was so obvious from Pfizer's own trials that children would miss school because of having the vaccines. So the argument is completely flaky. And the other thing, the most important thing, we have no long-term data. We do not know. Long-term data with the effects of mRNA and the spike protein, as Tess has beautifully explained, that may not matter when you're 77. It really matters when you're 7, and it really matters when you are 7 months of age. And there are too many questions which remain unanswered at this stage.